Good evening. Thank you all for coming tonight. So, how many people here want to live to be 45? How many people would like to make it to 48?
First time or second? Higher.
Exactly.
Double that.
So, you know, we have been working forever on some really sick people. And in the process of doing all this work, we've learned a few lessons along the way that it turns out that can help people age gracefully and into the hundreds. The interesting thing was I started off getting dragged to a radical anti-aging conference by a dear friend of mine. And radical anti-aging conferences are kind of one-third voodoo, one-third cult, and then there was some science thrown in. The science caught my attention. And a lot of the science is about reduction of inflammation in the body. Well, that's kind of something we're focused on constantly with our patients with chronic fatigue and chronic pain syndromes. And so it turns out there was a lot of stuff we could pull from that, and we're talking about that this evening. And there's a lot of science to anti-aging that's now coming about that's actually quite fascinating. And I think this whole business of keeping our joints healthy, keeping our bodies healthy, keeping our minds healthy is going to truly revolutionize what we're doing in medicine in the next 5 to 10 years. We're not talking about, 200 years from now. Harvard has an entire section devoted to studying anti-aging. And I just came from a conference where they were presenting some of their data. It's all about telomeres and how do you keep them long, how do you reduce inflammation of the central nervous system. A lot of the stuff we can do now. A lot of the stuff is available now. We'll be talking about that tonight. So, it's about being healthy forever. This is just us, and we've been around doing this stuff for a long time. We are the first integrative health center in the Washington, D.C. area. We were instrumental in getting an R25 grant from NIH for incorporating integrative medicine into the mainstream medical curriculum at Georgetown. Dr. Lisa and I have been at Georgetown forever. But this is a scary piece of information. I mean, look what's going on here. 1 in 9 people age 45 years or older are experiencing subjective cognitive decline. All right? 40% of people with subjective cognitive decline had to give up day-to-day activities. Over a third say that it interfered with social activities, work, or volunteering. Now, we're not talking about simply not remembering names, because I have never done that. What we're talking about is being able to remember what you read, retain new information. It gets harder in some people as we get older, but not in everybody. 81% of people with cognitive decline at least one chronic condition. Diabetes, heart disease. 41% of people need help with household tasks. All right? This is a big deal. These are talking 45 and older. Okay? We're not talking about 80-year-olds. We're talking 45 and older starting to experience serious cognitive decline. It ain't too early to start. Please come in.
So is this data in the United States
Yep.
or worldwide?
That's data in the United States. That data actually for the United States. 2015, 2016 behavioral risk surveillance, 49 states. That's depressing. That's scary. So, what are we talking about with quality of life? Well, this is kind of normally what happens to us, right? We're doing great, and we start noticing things in our 30s, 40s aren't working quite the way they did. First time I noticed it, I was 40 years old. I was roller skating with my kids in the rink, and I fell down. I went to pop back up, and my body checked in and said, "Why don't you lie down?" and I was not used to not bouncing. And that was the first time I started feeling things not working quite the way they should be doing. So this is what normally happens to us. This is what can. Maintaining an extremely high level of health, high quality of life, and then maybe at 120, everything just scraps out. But being alive, being vital until the day you die. That's the goal. You know, it's not about not aging. We're going to get older. We want to get older. We want to learn things. We want to hopefully gain some wisdom as we go through all this. But we don't want to be decrepit. We want to be able to be independent. We want to be able to have our minds fully active. And we want to be able to be out in the world doing things. We can help do that now. So, tonight, you're going to be able to hear from Dr. Lisa Wallenfield. Lisa's a dear friend, graduated from Georgetown, and she and I went through the residency program at Georgetown. She's been here with us since 1999. My memory. Lisa's been doing spectacular work with hormone therapies and anti-aging therapies for a long time without actually knowing that she was working in the anti-aging arena. She's an expert in functional medicine. She's also an expert in acupuncture and manual therapies. Does a lot of work with chronic pain and chronic illness patients. But really is getting increasingly involved in the anti-aging or optimal aging arena. So Lisa's going to talk with you first, and then we're going to have Rebecca. Rebecca Bergson is our acupuncturist, herbalist. I have known Rebecca. She went through the special master's program in integrated medicine at Georgetown 13 years ago. Graduated that, then went out west. Hello. Bastyr. Shame on me. Went out west to Bastyr, studied acupuncture. And then fortunately came back here and joined us. So she's board certified in acupuncture and herbal medicines. She's also going to tell you about, what do you want to call it? Acupuncture?
Cosmetic acupuncture.
Huh? Cosmetic acupuncture, which she's quite good at. And she claims she played an integral role in the Nationals winning the World Series. So, I might dispute that. Nevertheless, let me turn this over to Dr. Lisa. Rebecca, and enjoy the evening.
Thank you. Thank you. So much for being here. Lots of friends here. Patients that are friends. So I'm going to start with, welcome to looking good and feeling good through 100, vitality, strength, beauty, and great sex at any age. So I'm going to start with just an excerpt from a blog by Grant Cardone, author of Be Obsessed or Be Average. Goals aren't a New Year's resolution or a journal entry or a bumper sticker. They are critical to your life's happiness and fulfillment. Don't write goals down on a post-it note and look at them once in a while. Eat, sleep, and breathe your goals. Not just because you should, but because you can't not. Feed the beast so that it becomes so powerful there's no room for doubt. Because the moment you divert focus from your goals or take your eyes off them, you get lost in all the noise of your mind. So in healthy aging, at all ages, we need to be proactive. We can't be passive. We don't want to just live to 100. We want to be vital. We want to have the best quality of life. So I'm going to take you through what you can do for yourself through nutrition, sleep, exercise, meditation, and yoga, and then what we at Kaplan Center can do for you. IV vitamins, IV NAD, hormones, O-shot, and facial rejuvenation through acupuncture. So let's just start with the basics. Start with diet. So many different diets: paleo, Mediterranean, vegan, plant-based, keto, modified keto, low-fat. Now, what is the right diet? Well, if you have a condition like celiac, or you have diabetes or heart disease, or you have irritable bowel, or you have inflammatory bowel disease, or you're detoxing from Lyme disease, then working with our phenomenal nutritionist, Nor, she's absolutely so learned and so fantastic to work with, and she can help you navigate through diets. But I want to remind you of something that we all know about, that is just that nature has given us, and we just kind of forget about that. That's the colors of the rainbow. Okay? So we know we should eat lean proteins. We should eat good fats like avocado and nuts and olive oil, and avoid processed foods and sugars. But we kind of forget about these colors. Maybe we eat the same color all the time, or we maybe eat different colors, but we end up eating the same thing. So we want to get the variety of colors. We want to get the variety in the colors. So what do the colors mean? Example, red has lycopene, prevents cancer and heart disease. Purple and blue have anthocyanins, prevent cancer, stroke, heart disease, and are great for brain health. Orange, yellow have carotenoids and beta-carotene, good for eyes and mucous membranes. Green has carotenoids, indole, saponins, prevent cancer, help support our liver detox process. Brown and white, like garlic, has allicin, which is antiviral and antibacterial. And some of the brown foods like potatoes and bananas have high in potassium. So this is just a snapshot. What about the gut-brain axis? The brain and the gut are intricately connected. We have 100 billion neurons in our brain, and we have 500 billion neurons in our gut, and they're connected. Whatever goes on in our brain affects our gut. Whatever goes on in our gut, we have inflammation here, gut inflammation here. We're also connected by the vagus nerve. This is a long cranial nerve, so this is just a great demonstration of how our gut and brain are connected through an axis. Example, serotonin and GABA, two feel-good neurotransmitters in the brain, are also made in the gut. So the digestive system is covered by one single layer, and these cells have cilia. They're hair-like protrusions that increase the surface area of the gut, allowing nutrients to be absorbed. If we have inflammation in our gut, those cilia become blunted, so we have decrease of nutrients. We can also have leaky gut, gapping between the cells. Large proteins and toxins are absorbed, like lipopolysaccharides, and this goes into the bloodstream, sets up total body inflammation, and increases our risk of autoimmune disorders. So we can test here for gut health. We have several different tests, and we may be adding one that is actually a stool study looking at DNA of the microbiome, because of the bacteria in the gut that are so essential for health. And then using artificial intelligence, it tells you what foods you need to eat to improve your microbiome. So that's exciting. So whenever we eat, we have to think what we're putting in our mouth. Is it nurturing? Is it life-giving? Now, if we choose to indulge, that's fine, but just be mindful about it. This becomes a habit, which is a good habit. So Dr. Gary wrote a book called Total Recovery, and his book was based on brain inflammation associated with chronic illness. And the research was about microglia, which are these cells in the brain that are part of the immune system, and they keep our brain clean. But if we suffer from trauma, could be physical trauma, mental trauma, infections, environmental toxins, even sleep apnea, these microglia can get upregulated and excrete inflammatory factors and inflame our brain. So we here treat many people with brain inflammation, and we use some medications. One of them is low-dose naltrexone. It's a compound from a compound pharmacy. But there are supplements that you can use to decrease inflammation or to be proactive. Some of these are substances that are naturally produced, like CoQ10 in the body, and glutathione is naturally produced, as well as melatonin. Vitamin D comes from the sun. It's manufactured in the skin. And some of them are supplements that just support us. They're mostly anti-inflammatory, and they're antioxidants. So antioxidants will get rid of free radicals. Free radicals damage cells. So I'm just going to touch. So, by the way, this whole packet, you can go on our website and download it, and it tells about each of these brain boosters, we call them, all the research behind it, the dosages, and clinical applications. So this is available for you. If you have trouble, we have a new website. So if you have trouble finding or downloading it, just let us know and we can get it for you. But just to touch a little bit on each of them, CoQ10 is a fat-soluble substance found in the mitochondria of our cells. The mitochondria are the powerhouse of our cells. So they're involved in production of energy. And as we age, the CoQ10 can go down. There's a common medication, the statins, that lower CoQ10, so it's absolutely essential that you go on CoQ10 if you're on a statin. Curcumin is the spice that's the pigmented spice in turmeric, and it's a very strong anti-inflammatory. Much better, you can use curcumin or turmeric as an anti-inflammatory. It's much safer than an NSAID like ibuprofen or naproxen. Ginkgo biloba is from the leaves of a tree, a ginkgo tree, and it's very good for circulation. By the way, most of these are neuroprotective, so they protect the brain from neurodegenerative diseases and from depression and anxiety. Glutathione and N-acetylcysteine are very strong antioxidants, and they help our body to detoxify. We often use glutathione and N-acetylcysteine for our Lyme patients or our patients that are recovering from mold toxicity. Melatonin is a hormone that's produced in the pineal gland that's responsible for the circadian rhythm for sleep, but it's also anti-inflammatory. Vitamin D, we get that from the sun. Vitamin D is vital, is essential for our immune system. So making sure your vitamin D levels are adequate is important to keep your immunity up, prevent illness, as well as cancer. Omega-3 fatty acids found in fatty fish and flaxseed is very good for brain health. Quercetin is a bioflavonoid. It actually stabilizes cells that make histamine, so that lowers histamine, really good for allergies. And resveratrol, that's in red wine in the peels of the grapes, is cardioprotective and also prevents amyloid deposition associated with Alzheimer's. So what about sleep? Sleep deficit causes decreased productivity, can cause mood changes, depression, anxiety. It alters our hormones. Our growth hormone is produced when we sleep. Sleep deficit causes a depression of our immune system and affects our cardiovascular health. We need 4 to 5 deep to REM cycles of sleep per night. Adults need approximately 7 to 8 hours, and babies 16 hours, young children and teens 9 to 11 hours. How many teens really get 9 to 11 hours? So what prevents our sleep? What causes sleep deficit? Well, electronic devices is a big deal. The light bulbs, we have constant light. Medications, stress. We can have sleep latency where we have difficulty falling asleep, or we have early morning awakening. So we need good sleep hygiene. Avoid electronic devices 1 to 2 hours before bed. Keep the room dark and cool. The early morning awakenings, so cognitive behavior therapy for insomnia tells us that we want to associate the bed with sleep and sex, not with insomnia. So I tell my patients, if you wake up and you do not fall asleep within 10 minutes, have Plan B. Plan B, get out of bed, you have something you read or listen to music, you don't check your emails. And then you allow your natural circadian rhythm to take over. And the idea is to take the emotion out of it, because often when we wake up in the middle of the night, we start to get pissed off, anxious about it, and then our minds goes. But if you have this Plan B and you're not thinking about it, this works quite well. There are therapists that work with patients in cognitive behavior therapy. Now, apnea is a serious condition that absolutely must be diagnosed and treated. It's usually a partner that tells you that you're snoring or you've stopped breathing. What happens in an apnea is the oxygenation drops if it's obstructive sleep apnea. it drops and you have a partial awakening, but you have also fight and flight, all these hormones, adrenaline and cortisol shoot up, and this happens multiple times during the night. So guess what? That increases your risk for stroke and heart attack and myocardial infarction. So this must be treated and diagnosed. We can diagnose it with a home sleep study test, very easy in your own bed. And weight loss, CPAP, maybe a dental device, it must be treated. So if we want to live to 100, we need to take care of our sleep. We want to live to 100 and be vital and healthy. So these are some of the sleep supplements that I recommend for patients, either individually or in combination. 5-HTP is a precursor to melatonin, which are both precursors to serotonin. So if you're on a serotonin uptake inhibitor, you want to check with your doctor before taking those. Valerian is a nice herbal supplement for sleep, L-theanine, GABA. CBD, cannabidiol, works for some people, and it's I usually recommend a full spectrum, and you just have to it's just trial and error. You have to try different brands, different delivery systems. There's creams, there's tinctures, but know that if it is full spectrum, it's going to have some THC in it. So if you get drug tested, you'll have THC in your urine. Yoga Nidra is a wonderful guided meditation that takes you to theta wave sleep, and you can use it just kind of in place of a power nap. I use it all the time. It's wonderful. And then you can use it before bed, or if you wake up in the middle of the night. There's Yoga Nidra apps. There's free Yoga Nidra on YouTube. You can just Google it. And then we talked about cognitive behavioral therapy for insomnia. Exercise, sweating. We've known for thousands of years the benefit of sweating. So it's a recent study of New York City fireworkers. They tested the sweat. They found bisphenol A, BPA, and flame retardant in their sweat. We know that sweat will get rid of cadmium, lead, mercury, and we often recommend saunas for our patients that are detoxing from Lyme or from mold toxin, mycotoxin. But the best way to sweat is to exercise. So I do recommend when you exercise, break a sweat. I'm a big fan of activity monitors. I think we should know how many steps we're taking. We should know what our heart rate is when we exercise. We should know our resting heart rate. We should know calories burned during activity. I'm a little obsessive when I do my metabolic conditioning and weight class. I have my watch, and then I have another heart monitor that's up on a screen, and everybody else is doing it too, and we're all obsessed, and it's great. It's very cool. We motivate each other. If you belong to a gym and they have available cardiometabolic assessment, where you get on an aerobic machine with a mask and they measure volume of oxygen or VO2, and they can also determine what your heart rate zone would be for burning fat or burning carbohydrates. That would be really useful to know that data. They also usually, many gyms have good scales that measure your percentage of body fat and percentage of lean muscle mass, which is better than just weight. So again, data is good. Lots of studies show that exercise increases brain-derived neurotrophic factor, which is a fertilizer for the brain. It improves memory, enhances learning, increases resistance to insult, improves brain plasticity, which is the ability to change your brain with your thoughts and emotions in a positive way. I recommend to my patients the triad of resistance or weight training, cardio, and probably the best type of cardio is high-intensity interval training, where you get your heart rate up for a period of time, high, and then have a recovery, immediate recovery. And there's all sorts of different ways you can do that. But there was a study that showed that HIIT was better, improved memory better than just moderate aerobic exercise in older individuals. The third part of the triad is yoga, and I can put it with meditation. Yoga is very multidimensional. Yoga takes you through every joint, through every range of motion. It works on balance, and falls in older individuals causes high mortality. So if you have good balance, we're not going to fall. It also, Dr. Lauren Fishman did an international study using 12 yoga postures a day, standing, reversed osteoporosis. Yoga also uses pranayama, which is the breathing techniques. We know that deep breathing, different types of breathing, actually induce heart rate variability, which is a reflection of health. And our therapist here, Jody, wonderful therapist, I think she's here. Anyway, she works with our patients doing heart math. Is to show how breathing techniques will improve heart rate variability. In addition, yoga is a moving meditation, but it's also seated meditation and meditation in general. There's tons of research on meditation improving brain plasticity. So exercise is a really important part of our healthy aging. Now we'll move on to what we can do for you. Okay. So from the beginning of the practice, or at least I think it's the beginning, we've been doing IV vitamins, and intravenous vitamins are magnesium, B complex, vitamin C, glutathione, separate or in combination. So these are all minerals and vitamins that help support our liver detox process. They boost our immune system. They help our cells work better. Great for fatigue, for pain, for headaches, for improving athletic performance. Glutathione we use for traumatic brain injury concussions. The high-dose vitamin C for cancer treatments. Our newest addition is NAD, intravenous NAD. Okay. So this is a mouthful. NAD stands for nicotinamide adenine dinucleotide. It's a naturally occurring coenzyme that's found in every cell of our body, and it's intricately involved in cellular metabolism and DNA repair. So we have these proteins called sirtuins. We know there's 7 sirtuins. These proteins are called longevity proteins. Okay? Sirtuins are dependent on NAD. So we need that NAD to make our sirtuins. For example, SIRT1 is found in the hippocampus. The hippocampus is part of in the brain that's responsible for emotional memory. And so it improves memory, also protects against amyloid deposition. The benefits of NAD, of course, include it reduces inflammation, repairs DNA, improves energy, pain, sleep, cognitive function, and athletic performance. So our patients really, they really report remarkable results with this. If you're not a patient here, you can just schedule like a very short intake visit with us, and then you're free to get either IV vitamins or NAD. Let's start with testosterone in men. So in men, testosterone peaks around the 20s, and then it starts to decline. And some men don't notice much of a difference, they're fine. But there are many men who complain of depression, disturbed sleep, decreased muscle mass, increased body fat, low sex drive, and difficulty with erections. So testosterone can be tested, blood test, morning blood test. I usually do 2 to just verify if it's low. And it can be treated with Clomid, which stimulates the endogenous testosterone. So the male that has his own testosterone can be elevated with Clomid, or testosterone can be replaced. So it's not given orally because it can damage the liver, but we usually start with creams or gels or patches, but can use injections. And then our Dr. Dan, who's somewhere around here, he does testosterone pellets, and that is replaced every few months or reinserted every few months, so it gives a constant dose of testosterone. Well, testosterone, women have testosterone too, and guess what? Low testosterone causes fatigue, muscle weakness, reduced sex drive, weight gain, fertility issues, vaginal dryness, and loss of bone density. So every year, the North American Menopause Society, American Society for Reproductive Medicine, and Endocrine Society look at all the research regarding hormone therapy, including estrogen, progesterone, and testosterone, and they come out with a statement based on all that research. The latest statement was hormone therapy plays an important role managing symptoms for healthy women in menopause and 10 years beyond. So I very safely can offer hormone replacement for men and women, depending on the person's risks. But most everyone does really well with this. So, we all know the benefits of healthy sex. Improves relationships. It actually improves the immune system. In men, it decreases prostate cancer, reduces depression, and induces better sleep. Causes of sexual dysfunction in men can be anything from hormones, medications. There are medications like antidepressants or beta blockers, diabetes, atherosclerosis can cause sexual dysfunction. In women, the same. Stress, hormones, medications, but also women who have given birth, and especially have given birth multiple times. There's actually a change in the anatomy of the vaginal canal, and there's a decrease in sensation. So one of the tools in our toolbox is called the O shot. And there's also, by the way, the P shot. I don't want to leave the men out. That is available, and it would be very easy for me to get certified to do that as well. But the O shot is basically platelet-rich plasma. We've had platelet-rich plasma around for a long time in the orthopedic world. Basically, your blood is drawn, blood is spun down, the platelets are isolated in the plasma, and it's injected for orthopedics. It's injected into a joint or tendon to repair. Now it's being used for a number of other reasons. And so they found that these platelets have very rich growth factors, so they improve the circulation, they improve the nerve function. And for the O shot, basically it's in the vaginal area, a couple different shots, different areas. It is painless. I use a topical anesthesia and a little bit of a lidocaine injection.
And what does it do?
So we're gonna go over that. So there was a pilot study, 2017, study of 68 women, Brazilian clinic, that showed that PRP O-shot improved overactive bladder, urinary incontinence, lubrication, arousal, pain, or anorgasm. So these are the indications for the O-shot. The founder of the O-shot, his name is Dr. Charles Reynolds, he encourages the providers to enroll patients in studies. This is not big pharma, so it's hard to get money to study, to do big studies on this. And I have enrolled anonymously my patients. They've volunteered to enroll so that we can keep track of the effects of this. So lastly, the last slide here, this is the house of optimal health. So the things in the red are things that can undermine your optimal health. Drop in hormones, high cholesterol, high blood pressure, C-reactive protein indicative of inflammation, high insulin and high glucose and diabetes, poor kidney function, low vitamin D. So these are things that we can test for and we can treat. And in the green, these are the things that are the current research and uses for age reversal. Okay? So for example, senolytics. Mostly they're using cancer drugs, and what they have found that these drugs actually kill off these cells called senescent cells. So senescent cells are cells that stop functioning, and they start to recruit other cells to stop functioning. And they're also called zombie cells. So these senolytics actually get rid of the senescent cells. We don't want those zombie cells around. The mTOR inhibitors also work on senescent cells, and there's some other mechanisms that work to extend lifespan. These are also some cancer drugs, some drugs that have been used for transplant, to prevent rejection of transplant. But there's an mTOR inhibitor that we use all the time, and that's metformin or glucophage we use for diabetes. And Dr. Gary's had more experience. He's tried it on many of his patients, and he's had some very good effects with it. NAD we talked about. There's some research on very young plasma where you get a young person to donate their plasma, get injected with it. That's up in the air, whether that's helpful. Stem cells, we do also, exosomes are produced by stem cells, and they're it's called vesicles that are produced by the stem cells, and they have all the growth factors of the stem cells, but they're a little more refined. And Dr. Dan, I don't know if he's still here. Yeah, there he is. He does these things, stem cells, exosomes. So he's a guy. So that's that. We've gone over everything here. So we've gone over what you can do for yourself to have optimum health, to live to 100 and be vital and strong, and through the things that we talked about, and then what we can do for you here. And I'm going to take a few questions before I pass the baton over to Rebecca. Yes.
Yeah, I guess one of the hard problems in anti-aging is the clinical trials take forever. And so if one had something like an epigenetic clock, one could measure changes on to see how you're aging. Are you going forward or reversing? How close is that to being practical?
Want to answer that?
I can. So there's a lot of work being done on that. Specifically, they're looking at like the telomeres at the moment. So telomeres is little tails at the bottom of DNA, and basically they shorten as we get older. And so you can actually look at telomeres and determine your biologic age. And more importantly, we can't do it now clinically. But what we do is we take what we've seen in the lab with things that we know in AD, for instance, that increase telomere length, and use it here. So we're simply transposing stuff that we know from the bench, the lab studies that we do, and being able to use that to increase telomere length. Exercise, increase telomere length. Proper sleep, increases telomere lengths. Proper diets, increase telomere lengths. Okay, so there's what will actually slow that biologic clock. Meditation increases telomere lengths. So, you want to be looking at this stuff. Probably, we don't know yet, we've got some early data looking at the exosomes. The exosomes are, as Dr. Lisa was saying, these anti-inflammatory things. We can actually inject those IV. They cross the blood-brain barrier. And they also seem to allow for telomere length to occur. Very interesting data that I just learned at this conference. We're looking at AI in terms of so artificial intelligence, what's going to happen in the next couple of years in medicine. They took an AI and they turned it on looking at retinal analysis. All right? The AIs turn around and say, oh, this is a male retina, this is a female retina. Now, the ophthalmologists are all going, what do you mean? Well, the AI is actually correct to 100%. So it's able to bring in a bunch of data that we didn't even know was there to make that distinction. Well, what else can it do? It can predict your age within 6 years. Your biologic age. So that's coming down through a simple retina scan. That's coming down. There's also a really interesting trick on all this is that while the AIs can tell us that piece of information, they can't tell us how they tell it. So we don't know how they know that.
So Gary, just to be clear, you're saying that we can stop the shortening of the telomeres, or we can actually lengthen those that have been shortened?
We can stop and reverse them.
Both.
Okay? and these mTOR inhibitors that Dr. Lisa was talking about. So we've got this whole anti-aging crew who's been guinea pigging themselves on metformin and rapamycin, low dose. Now rapamycin in particular is an agent, Dr. Lisa said, to stop the rejection of organs so that we transplant. It's also used as a chemotherapy agent. Nasty side effects, lots of them. However, we use a little tiny dose, about 5 milligrams a week. It looks like it'll actually slow. So what mTOR is all about the creation of antibodies in the body. Okay, so it slows the whole inflammatory process. And so the mTORs, rapamycin, looks like it can slow the aging process, the reduction of inflammation in the body. Okay, metformin does the same thing. I've got a number of patients who have an autoimmune process going on in their bodies as a result of infections. How do we shut that down? We use IVIG, which is very expensive, but you can also use metformin, which is very cheap. And the anti-aging crew is all using this. It's reducing inflammation. One of the other discussions we had this last week in San Diego is what is Alzheimer's, all right? Alzheimer's is not these beta tangles. Now there's some controversy in this, but there's all these beta tangles that go on in Alzheimer's, okay? Except that we have a group of people who have lots of beta tangles in their brain, okay? Tau fibers. Except they don't have Alzheimer's. Why is that? The answer is inflammation. If you see lots of microglial activation going on, then you get Alzheimer's in addition to the beta tangles. If you do not have microglial activation, I don't care how many beta tau tangles you have, you don't develop Alzheimer's.
I've read that there's research that suggests that Alzheimer's is actually diabetes 3. Is that
so? There is a subcategory of Alzheimer's, which is a type 3 diabetes. We actually don't know how to diagnose that, but we can treat it. So you can actually deliver insulin into the brain, because insulin doesn't readily cross the blood-brain barrier, but we can deliver it through a special nebulizer, $5,000 toy at the moment. But you buy it, and it will actually nebulize the insulin in small enough particles and high enough up to be absorbed by the neurofibrils in the cribriform plate and be absorbed into the brain. Okay, it's not opinion. There's actually very good research on this stuff from a number of our institutions. University of Washington in particular has done a lot of great work on this. So we know this stuff gets absorbed and we know it can make a difference. So yes, type 3 diabetes is one type of Alzheimer's subtype.
Yeah. I was wondering about the microdoses that also for lithium, for example,
Yep.
are supposed to be good for the brain. And they improve the action of electrolytes, cleaning away waste proteins.
Right.
What is it about microdoses that we're missing? If we do a drug trial, we look at the highest dose that doesn't cause adverse effects, but there may be things well below that where it's beneficial. So for the naltrexone, it also being used in cancer treatment, but the microdose.
So, low-dose naltrexone is an excellent example. We have a lot of experience with it. I know the mechanism of action of low-dose naltrexone. So what happens is at the higher dose of naltrexone is the drug we use to reverse the occurrence of fatal overdose from narcotic. Okay? However, if you use 4.5 milligrams or below, and we can go as low as 0.25 milligrams, which you have to have compounded, it actually reduces microglial activity. Microglia is the innate immune system and central nervous system inflammation. It also will help stop Crohn's disease from being active in other autoimmune processes. So I'm not sure what the mechanism is in terms of how it shuts down the autoimmune processes, but you're absolutely correct in using its microdoses. Lithium, in and of itself, is an anti-inflammatory in the central nervous system. So you don't even have to use microdoses, though you can. Lithium orotate in 5 milligram doses is different than the lithium carbonate that we use for treatment of bipolar disease. But you can still use 125 milligrams of lithium carbonate. It's a small enough dose to be anti-inflammatory in the central nervous system. Found it very effective for that. Also, the SSRI, the selective serotonin inhibitor, the way they work is very anti-inflammatory. That's why it takes 2 weeks to a month to really see the effect on somebody. But I need to let
Yes.
Rebecca go on, because I'm.
Anybody have any other questions?
One quick one. You said that you were recommending using hormone replacement therapy in women 10 years out from menopause. What about 20 years out? What about?
Well, I do have women that continue on. It's really a choice. We work together to decide, how long we want to do
Okay,
it.
but
I'm
any
not gonna be like-
adverse?
But,
any
you know,
reason
it-
not to?
There are, we do have ways to determine how you're metabolizing it.
Right.
There's actually, blood tests and urine tests that can determine if you're metabolizing it in a healthy manner. There's actually some of the supplements I talked about, magnesium and B complexes and some other things like Indol 3C help the metabolism of estrogen in a positive way. So it depends on the person. Can't be across the board that, that's it, you can't have any more hormones. So it's really an individual. And the other thing is that I use delivery systems that are much safer than what were in the Women's Health Initiative study, which was Premarin from pregnant mare's urine,
Right.
oral. We use transdermal creams and patches.
Thank you. Sure.
Okay, right, you're on. Oh, yes.
Thank you.
Since you guys have been sitting for about an hour, why don't you stand up and just kind of shake out a little. Sometimes I'll do this thing where I shake my hands a little bit, just give it a little wiggle, keep your legs up a little bit. And since I'm an acupuncturist and 220 is really important, just give a little tap on the top of your head. I can kind of wake you up a little.
Were you in kindergarten?
That's wonderful. Okay, very good. Thank you. So, here. So thank you, Dr. Lisa, and thanks, Dr. Sherry, for that lovely introduction. I actually had a slide for my own credentials, and I took it out, which means that I think this is my first slide, yes. I'll tell you why this is important, because this is from 2017. And I did not wear any article of clothing this year that I did from 2017. So that is exactly why they won. So moving right along. So we're going to talk about cosmetic acupuncture today, and it's something that's gotten a lot of attention recently, certainly in the last 10 years or so. But our friends, the celebrities, have definitely come to that. And it's something that's, it's a more natural approach to reducing wrinkles and bringing facial rejuvenation. So Gwyneth Paltrow, Kim Kardashian, this is Millie McKenzie, who apparently is a British star, but I just like that picture. And David Duchovny, great picture. It was on the front of Esquire magazine. But please know that you will never look like that. That was absolutely done for the cameras. But it's kind of an interesting picture. But if any of you haven't had acupuncture, how many of you have had acupuncture? Okay, and how many of you have not? Okay. So if this makes you squeamish at all, which I know it definitely does for some people, just notice that they look pretty darn relaxed. And that is the experience of acupuncture. That is also the experience of facial acupuncture. And we'll talk a little bit more about that. So I just wanted to list a couple names that it's sometimes referred to: cosmetic acupuncture, facial rejuvenation. Sometimes the term facial acupuncture facelifts is put out there. I don't like that name because it's not surgery, it's not a facelift, but it does sometimes produce those desired effects, which is nice. So what are we targeting here? We're targeting wrinkles. I go through these for a reason, because we can actually target using acupuncture the specific wrinkles. So the small lines around the lips, worry lines, those nice little lines that we always make when we look frustrated. forehead lines, crow's feet, around the eyes, bunny lines are the little guys across the nose, and marionette lines, which are these lines kind of on the side of the mouth. Now, when somebody comes to see me for facial acupuncture, I'm not telling them what they need or how they should approach this. I'm asking you what you want, because sometimes different lines don't bother people, and different lines bother people for different reasons. I had a patient ask me about those kind of worry lines, which really bothered her. She was younger, because she got them when she started getting migraines, and so she wanted them gone because they were just a constant reminder of how she was in pain. So everybody wants these things for different reasons, and I'm going to listen to this, basically the message. Other things that can be helped: neck wrinkles, sagging. There's a muscle that we do this kind of pops out called isthmus, and that tends to get kind of bunched up as we age, and it's just the effect of gravity. And sometimes when you release that, it just smooths the whole neck, and that goes for a number of the other wrinkles as well. I'll be talking about the mechanism a little bit, but it usually takes a month to start noticing differences, unless we're talking about wrinkles from a direct muscle implication. So if you release a muscle, sometimes one treatment you start noticing a difference, and that is very, very common for the kind of forehead wrinkles. So other things that can be helped with acupuncture: dark spots, hooded eyelids, also known as ptosis. This happened recently to a patient of mine who I didn't even know she had this condition, but I released some of the muscles around the eyebrows, and she saw more clearly than she had in years, because it lifted the eyebrow, and it lifted the eyelid. So the acupuncture can definitely help with that. Also scars on the face or anywhere else on the body, really. Acupuncture can reduce the appearance of the scars. And this is also the case for scars from acne. And they can be new scars or old scars as well.
And how does that work? How does that work? Can you explain that at all?
The scarring?
Yeah.
So let me go through this, because along the top are kind of the reasons why you get wrinkles, and this will answer your question. So the first thing is circulation. Digestion diminishes, hormones as we age, and acupuncture will actually increase circulation to the face. So we're bringing new blood supply, and it's going to reduce inflammation. And acupuncture supports digestion, balances hormones, even without changing anything else in lifestyle. Also just the effect of gravity. So you're going to improve tone and elasticity. And same thing, we're bringing a lot of energy to the face for this process. This is one of my favorite things. Is we have habitual patterns of expression. We all are around people that we love all the time, and they tend to make the same faces over and over and over again. And we can see it in other people more than we can see it in ourselves, right? So by kind of resetting the face in this way, it can actually kind of clear those patterns of expression. I had a patient who told me he wasn't coming for the facial acupuncture, but I was using points kind of in the forehead, and he was telling me that at work he wasn't making that same scowling face that he always made, and as a result he was in a better mood, and that's really nice. And again, you get that benefit almost immediately from acupuncture. So with the scarring, what you're doing is releasing the scar tissue. So there's a technique where you're literally surrounding the scar, and breaking up the scar tissue. You're bringing new blood to the area and releasing that scar.
Is that a before and after picture there?
Actually, I think they're both
Way
beautiful.
So how long do the results of the treatments last? Does this get to
We'll get to that.
Okay.
Yes. Yeah. Okay, so how it works. We talked about stimulating the face with acupuncture needles. So we're using very specific acupuncture points, as well as targeting wrinkles, which is the slides that we just looked at. So here we have, basically what happens with the body for when we get any kind of wound or an injury. So it stimulates a healing response, and that healing response is going to include collagen. It's going to improve elastin, and it's basically by having these like tiny little micro traumas to the face, you're stimulating this healing response, and it takes about a month to stimulate collagen in this way, which is why usually we're not going to look at results until about a month into the process. Again, we're increasing circulation to the face, which reduces inflammation. And I think this is the best thing about the acupuncture is that you look like yourself. It's not something that has the concern of possibly making you look a little bit different. And one of the things that is most commonly reported is that the people just have that glow, and I think that's a beautiful thing. So other benefits of acupuncture, these are the side effects, we'll call them, of cosmetic acupuncture, is that it promotes homeostasis and self-healing, improves sleep, reduces stress and stabilizes mood. So these are, you come in for wrinkles and you leave with this, right? Pretty good. Strengthens the immune system, balances hormones. So, things like hot flashes or, painful periods, that's something that the basic protocol of this type of acupuncture would help with, actually. And then the general things that facial acupuncture that helps anyway. So if somebody has TMJ, they're going to be using the same kind of points. If somebody comes in with like a chronic sinusitis, these are the same points, and so it can help clear out, just open the sinuses, and again, these are the side effects. So yeah.
You said it takes about 28 days to see results. Is that based on once a week treatments,
Yes.
twice a week? Or?
Yes, once a week. Yeah, there's some kind of schools of cosmetic acupuncture that do 2-3 times a week, but I do once a week,
Once a week, 30 minute?
it's a 1 hour
1 hour.
treatment. Yeah. So expectations. So a lot of this is based on kind of your constitution, your lifestyle. If somebody comes in who's a smoker and is eating fast food and doesn't move, they're gonna have a little bit less results than somebody who is doing everything that Dr. Lisa talked about in her slides. But you can expect on looking about 5 to 10 years younger after a course of acupuncture. Again, this is depending on your body constitution. And then what's kind of neat is that after that, this is to answer your question, you age from that point. And of course, you do need some maintenance treatments of, about once a month, but you'll age from that point. And these are great health benefits anyway from the treatments. So things to consider, and these are not kind of true contraindications, but it's more from a Chinese medicine standpoint. Doing a lot of points in the face draws energy up, and so where that's not a good idea is if somebody has uncontrolled high blood pressure, migraines. Sometimes that type of treatment can stimulate a migraine. Seizures. I wouldn't recommend this for somebody who's pregnant or who's kind of in the midst of treating chronic illnesses. And I say that because we're going to be diverting energy to the face to kind of create this process. And so if somebody is working on healing their stomach, let's focus on that first before doing this. And like I said, acupuncture can be really helpful for those medical conditions. So let's treat that first.
What about arthritis?
So arthritis is something that acupuncture can be really helpful for. I wouldn't. It kind of depends on the situation. If it's something that's kind of debilitating, and that to focus on that first, or it can be something that we can just include in the treatments as well. So I wouldn't say that that's a medication, but it's definitely something that I would want to talk to someone about first. So some cautions. There's there's a lot of things out there that people are doing, and it's hard to even keep up with it sometimes. Botox is something that's really, really popular right now, and you have to remember Botox is a neurotoxin, and so it's actually designed to stop the muscle from working. And so when you think of acupuncture, increasing circulation, healing, releasing toxins, it's actually going to have an adverse effect on the area, meaning it's going to the area of Botox is going to not last as long, if that makes sense. So we usually just avoid the area for about 3 to 4 weeks or until it wears off. But we can still do acupuncture on other areas. Lasers, about 3 weeks is typically the waiting period. And then for fillers or microdermabrasions, I just recommend that people go to their providers who they received the treatments from and ask them how long they should wait for acupuncture. Because if you and paid for these, we want you to get the maximum benefit from it. So that's really the best way of doing that. So one thing I should mention is for people who have had surgeries, that acupuncture can actually make the surgeries last longer. So after an initial healing period, it's actually quite nice to do acupuncture in the area for it to have a longer effect.
If you had Bell's palsy before, is this going to kick it back in?
No,
Is
not
that
at
in your
all.
face? It's
Bell's
not-
palsy, acupuncture is just so helpful for Bell's palsy that it's actually a treatment for it. If anybody has Bell's palsy or has friends, tell them to go to an acupuncturist because it'll reduce the amount of the symptom time tremendously. So, but it definitely won't
trigger.
No. Okay, so what are the sessions like? I recommend that people come in with a clean face, or I always provide face wipes. Wearing loose-fitting clothes, and make sure you have something to eat because acupuncture can lower your blood sugar a little bit, and we don't want people to feel dizzy. In terms of how it feels, a number of you had said you've had acupuncture before, and a lot of the times we use points on the face. What's interesting is that the acupuncture needles that I use are much smaller than the typical acupuncturist even uses. So I brought some examples if afterwards you want to see them. Some people like to see them, some people don't. I totally respect that. But I mean, we're talking a little bit thicker than like a cat's whisker is the thickness, and the I usually tell my patients that you might feel like a little poke going in, but once it's in, you might feel like a little bit of like heaviness or like a dull ache, or like a shifting or a movement. But most people fall asleep when they have the point points in their body. It's really quite relaxing. I was surprised myself when I did my training in facial acupuncture. I don't think I'd ever had that many points in my face, and I was a little concerned about it, and I loved it. I mean, it was so relaxing, and I thought about putting a picture of myself with all those points in, but don't have it this time. But it's truly a really relaxing experience, and not one that you would expect, because we don't like needles in our culture, and I totally understand that. So in terms of the cost, I recommend doing a consult, which is just 30 minutes, just to talk about what your interests are, what you want, if you're a good candidate for it, and talk a little bit about your medical history as well. Each session is a full hour, and I recommend doing 12 weekly sessions. And like I said, usually about after session 5 is when you start noticing differences, because you start getting that collagen. And this is something that we don't do very often around here, but if you guys are interested in doing a package, you can either call the office, or I think there's a sign-up sheet maybe outside, and we can give you a call. And if you purchase the 12 session package, you get 10% off. And you can give that as a gift or use it yourself. And if there's some things that if there's reasons that you want to wait, that's okay too. We can talk about it. Yeah.
How does that pricing compare to fillers or Botox or anything else? I don't even know if you know the answer to that.
So I don't have the exact numbers, but usually, for those kinds of treatments, you're talking about a couple $1,000s, and they don't last. They last 5-6 weeks, but I think it kind of depends. I can do some research for you, let you know if you like.
Question.
Yeah.
So you're saying you do the 24 days, the 24 sessions, 12 sessions, and then after that you have to come back once a month to maintain?
About once a month, yeah. It depends on the person, but about once a month is a good maintenance plan. So, and this is something else that helps with maintenance. There's derma rollers or something that's become quite popular. AccuLift, which is a derma roller that's been approved by the American Acupuncture Council, which provides practice. It's the only acupuncture grade roller like this, and what it is it's a roller that has, for the body, it has about 540 needles on it all the way around, and there's a one for the body, which is a little bit wider, that has about 1,000 needles, and you can do this at home. It's regulated like a razor, and what you do is you just kind of roll it on your face, and I recommend doing it once every 3 days to start with, and then you can increase. And there's it's always nice to do a serum afterwards, and there's one that we have here from a company in Florida called Gracefully Made USA, which has hyaluronic acid, collagen, and vitamin C. Very, very simple, and just kind of gets that nourishment straight to your face. And these will also increase the results as well, and help it to last longer. And you do have to replace them about similar to a razor, about 3 to 6 months. When it starts to kind of irritate the skin, that's when it's time to get a new one. And I have some examples of those if you'd like to see them. So just a thank you. These are my teachers who I've learned cosmetic acupuncture from. And this is my mother. We were at the World Series game. Let's shock you a little. So, and the parade. So, anyway, questions, Nats or otherwise related?
Is the acupuncture roller work with sensitive skin?
So I find that people with sensitive skin can also use it. you basically apply whatever pressure you want to it. And so with sensitive skin, so there's the way that you do it is you kind of go up and down 3 times, and then across, up and down 3 times. And so what I would do is start at the very minimum, like maybe not even do that, and then not apply too much pressure to it, and just see how your skin responds. But I have very sensitive skin, and I don't have a problem with it. You might also want to get or replace it a little bit more often, but it doesn't seem to stop people from using it. Any other questions?
Yeah, I've always seen metal needles being used. Do people ever use glass needles?
Glass needles. I have never seen a glass needle. That would probably be too thick, is my guess. I've never heard that. Yeah, different metals are more typical. And the needles that I use for face are actually coated in like a silicone, so they could glide in a little bit easier. That's more typical of the Japanese style needles. But glass, that would be interesting.
Well, it'd be interesting because then you can do FTR, internal reflection measurements, and watch changes in chemistry.
Yeah. I'll let you know. I haven't seen that one. Anyone else? Excellent. Well, thank you guys.